Good morning, everyone. This is Susie Wilson at the Iowa Department of Public Health, and we're going to get started with our webinar. I just pushed the recording button so you all can know that this webinar is being recorded and will be shared. You can refer to it later if you need to, or share it with those that have missed the training. And I'm glad that you could all sign on this morning, and a lot of new faces, which is exciting, and I look forward to meeting you tomorrow. So just a little bit about why we're getting together today. I wanted new educators and new project directors to get some background information on Pick a Better Snack, as well as dive into the lessons a little bit more. Many of the educators that have been with us for some time have heard all of this information, and so don't need to hear it again, as well as they're really experienced with the program. A few housekeeping items to cover before we get started. I have scheduled like an hour and 15 minutes for this webinar. I have a feeling we'll get done early, but I wanted to make sure we had enough time. I also have Marilyn Jones, who is our program contract manager on the webinar. And while I don't have scheduled to go over any of the fiscal or contract issues today, if you do have questions, she is on and can take those. You will have chance to talk about that and ask more questions tomorrow. I will take questions a couple times throughout the webinar. One is about halfway through and the other is at the end. So you can at any time use the chat box and type in your question, and I'll try to monitor that. I may ask that Sarah Taylor Watts, who's another one of our consultants here at the department on the webinar, if she could help me monitor that in case I miss any, but I'll try to check those at least at the question time. And I do have everyone muted. If you want to speak, you can unmute yourself. Just kind of remember that you are muted. But it does help with our background noise if we have folks muted. At question time, I'll try to unmute everyone so that you can freely talk. And I do have quite a lot of information to go over. So sorry that it's not maybe as interactive as I'd like it to be, and I have quite a few notes, so I'll probably refer to them. So if you see me looking down at that, that's what I'm doing. I just don't want to miss anything with so much information to cover. Here's what we'll discuss over the next hour or so. We're going to talk about two programs, SNAP and SNAP-Ed. Want to talk about the key strategies for SNAP-Ed, specifically direct education and social marketing. I'll tell you about the infamous Wave 2 evaluation. We'll briefly look at our program logic models. I will open up a lesson and walk through that, and I'll show you the many program resources we have on our website if you haven't had a chance to look at those yet. So let's get started and talk about SNAP. So this is the program that we're funded under. SNAP is short for Supplemental Nutrition Assistance Program, and it's our nation's largest safety net against hunger. It is a USDA program. You may know it as food stamps. That's what it was once called, but it's been changed for many years. But for some reason, that name still resonates with people, but it is officially called SNAP. Now in Iowa, the program's called Food Assistance. I don't know the whole history behind why they don't just call it SNAP, its official name, but in Iowa it's called Food Assistance, so you will hear that reference. It's also known just kind of on the streets as EBT. That's just kind of what folks often call it, which EBT, if you're not aware, is electronic benefit transfer, you know, the little cards, credit cards, or it's called an EBT card now for SNAP, and WIC also has an EBT card. So SNAP does serve low-income individuals, and the income guidelines are set at 130% of the federal poverty level. Just a little bit about how the SNAP program works. Individuals or families receive benefits or money really on this EBT card, and it's based on the family's need. So when an individual or family applies, there's a whole formula that seems quite complicated. We will have someone from SNAP at our meeting tomorrow if you have more questions about this, but this formula, looks at their gross income, and it does take into account for some of the expenses like housing and childcare, and determines kind of their benefit rate. So, the less money you have, the more food benefits you'll get on this card. And typically SNAP participants are very poor. They're even below the 100% of the federal poverty line. And to continue getting SNAP, you have to reapply like every 6 to 12 months. Just as an FYI, SNAP benefits can't be used for alcohol, cigarettes, vitamins, non-food grocery items such as household like cleaning supplies and things, or hot food. It really is food you would take home and prepare. In Iowa, the average household benefit in 2017 per person was $106.73. That's per month. So it's not very much money. And it comes out to $1.20 per meal per person. So it is truly supplemental. You can see that really doesn't go very far. Who are our SNAP recipients? Nationally, there are over 42 million people that use the SNAP program, and it's over 350,000 people in Iowa. Now, most SNAP recipients have children that live in the household, and so that's why with SNAP-Ed it makes so much sense to focus efforts on children, because they make up a large proportion of the SNAP recipients. You might find it interesting to know that those not eligible for SNAP are most college students. I don't really know the logic behind that. Illegal immigrants are not eligible. You have to be a U.S. citizen, or those with visas can receive benefits. I understand there are some types of visas where folks aren't eligible. And again, our SNAP representative maybe provide more information on that. So if you click this link, and I hope all this going back and forth works with our technology here, but this takes you to our website, and you can see we have a page here on the SNAP program and SNAP-Ed with some connections to the Iowa Food Assistance. That will take you to the DHS, the Department of Human Services website, and you can find more information there. And then SNAP-Ed Connection, that's just kind of an information house and resource center for SNAP-Ed. So I just wanted you to know that is there. So moving on to SNAP-Ed. Now, SNAP is a USDA program like WIC. You might be familiar with WIC, that issues food benefits, but the programs do differ in many ways, and we won't go into all of their differences. But one difference that I want to point out is that WIC provides nutrition education at the time benefits are issued, whereas SNAP has a separate program for nutrition education called SNAP-Ed. And that's where we come in. And SNAP-Ed is a nutrition education and obesity prevention program also administered by USDA. It includes both nutrition and physical activity initiatives, okay? The goal you see on the slide, this is the goal of the SNAP-Ed program nationally, is to improve the likelihood that persons eligible for SNAP will make healthy food choices within a limited budget and choose physically active lifestyles consistent with the current dietary guidelines for Americans and the USDA food guidance. So you remember that I said to be eligible for SNAP benefits, the income criteria set at 130% of the federal poverty level. Now for SNAP-Ed, we're able to serve an audience with a little bit higher income. We can reach those that have incomes at 185% of the federal poverty level. And this is the same income cut that WIC uses to be eligible, and the same that the National Lunch Program uses for the reduced price meal. So if you have an income 185% of the federal poverty level, you would be eligible for reduced price meals and school lunches. So more about SNAP-Ed. It operates in every state. It looks a little bit different in every state. The types of programming that takes place also takes place in Washington, D.C., Guam, and the U.S. Virgin Islands. And I thought, ooh, maybe I want to do SNAP-Ed in the Virgin Islands. It is authorized through the Farm Bill, and if you follow what happens nationally, you know that the Farm Bill was supposed to be reauthorized by September 30th. And last I knew it didn't happen. And so I haven't followed it here in the last few days, and maybe Marilyn will jump in at the end, but I think we're looking at possibly a continuing resolution until they can come to agreement on the Farm Bill. Funding for SNAP-Ed is based on a formula that was outlined through the Healthy and Hunger-Free Kids Act of 2010. So here's how the funding works. USDA gives money to every state, and it goes to the DHS offices in the state, or the Department of Human Services. And then the DHS office can decide what to do with the money, really. They can keep some for themselves to administer the program. Most contracted out. In Iowa, it's subcontracted to the Iowa Department of Public Health and Iowa State Extension. Our DH office does keep a small portion of it. It's not very much. So here's a little bit about SNAP-Ed in Iowa. These are all the programs that are administered by both Iowa Department of Public Health and Iowa State University Extension and Outreach. We do work together to submit our state plan, it's called, so it's kind of like our grant application, and we work together to do year-end reporting, and we try to collaborate and partner as much as we can in doing the different initiatives. We've kind of divided it out so that Iowa Department of Public Health would focus on children and older adults, so kind of both ends of the age spectrum, and Iowa State Extension would focus on parents, like moms. I think we have a lot of extension folks on the call, so you may be familiar with the program Buy, Eat, Live Healthy, and that's funded by SNAP-Ed as well as FNEP. So there's kind of two funding streams that support that program. Another SNAP-Ed initiative from Extension is Growing Together, and this is gardening, where community gardens are given funding to grow produce and then donate to a food pantry. So that's another SNAP-Ed funded project, as well as Spend Smart, Eat Smart. If you're familiar with Iowa State's online resources, and they're awesome, this is also a SNAP-Ed initiative. So here I want to talk about SNAP-Ed strategies that are used across the board in all states. So for the most part, a state can classify their interventions as one of these three different types: either direct education, or policy system and environmental changes, which we call PSEs, or social marketing. So if those terms are new to you, I'll try to define them here a little bit. Direct education is that kind of traditional nutrition education where you're teaching one-on-one to an individual or a group of people. So it's what we think of when we talk about our Pick a Better Snack classes. That's direct education. PSEs are initiatives that make changes to policies, systems, or environments. And they're changes that can take place in different settings or sectors. That's something that we talk about, such as schools and school districts, city governments, healthcare, food systems. That's the type of sectors we work in with PSEs. And PSEs really are about making the healthy choice the easy choice. So the healthy choice is kind of the default. So people, maybe without even thinking about it or realizing it, will make a healthy choice. They typically impact a lot of people, and you really kind of get more bang for your buck. So direct education can be expensive because it takes a lot to pay someone to teach. and you can only teach so many at once, where a change to a environment or a policy that's going to stick around and not go anywhere is going to impact a lot of people over time, and can be very cost effective. Social marketing might be a new term to you. This is using traditional marketing, like if you're going to market Nike or Coke or Pepsi or something like that, but instead you're marketing to individuals or organizations to make a behavior change, a healthy behavior change. So in our program, when we talk about social marketing, we're talking about our Pick a Better Snack campaign, also called Fuel Your Fun, or we're talking about our physical activity campaign, Play Your Way 1 hour a day. So in social marketing, like all good marketing does, we really want to make sure we know our audience and that we're very consumer focused. So we really want a deep understanding of their thought process, what they're thinking about, what motivates them, why do they do the behaviors that they do, and why don't they do maybe the behaviors that we want them to do. So there's a lot of formative research that goes into these projects, and we're trying to identify kind of an emotional hook. So what moves people to act? Social marketing is very research tested. It kind of has this ongoing monitoring and evaluation piece and uses a lot of different channels to market: TV, radio, billboards, newspaper, posters, all kinds of things, and we can talk more about that. I don't have plans to go into that a whole lot tomorrow. We'll see if time allows us to do that, but we'll talk about it over the next few months. We also have something called indirect education, and I don't spend a lot of time on that, but that's just kind of when you think about what the word means, when you're indirectly reaching someone. So all of our take-home materials for parents are considered indirect education. We're not seeing them face to face, but we're getting our messages and communicating to them indirectly. So these strategies, which you'll hear a lot about, direct education, social marketing, and PSEs, they're based on a premise that there are lots of things that impact a person's food or physical activity choices. So if you have any kind of background in nutrition education or public health, you may be familiar with this model. This is the socio-ecological model, and it's used to describe in SNAP-Ed how people make nutrition choices. So when we're talking about our Pick a Better Snack classes or our direct education, we're really talking about this first level, or where we're reaching individuals and we're giving them knowledge and skills. When we talk about policy, systems, and environmental changes, we're talking about working in the outer layers of this model. So we're working in settings, we're working in a school and maybe adding a salad bar or building a garden, or we're working in sectors, making changes to how a food system works and maybe bringing in some more local foods. So just to kind of give you some background in the basis for this. And I wanted you to understand all that terminology because it's used to define Pick a Better Snack. So Pick a Better Snack is known as a direct education and social marketing intervention. In fact, it's an evidence-based intervention, which is something that USDA requires. So anything we do in SNAP-Ed must be evidence-based, which is good. We're using taxpayers' dollars. We need to make sure that what we're spending money on works. So USDA requires that all of the intervention states do be evidence-based, and they've put together something called a SNAP-Ed toolkit. And I'll try to go to this. And sometimes on the slides, I put information on there so that when you're looking at these slides later, you can remember, oh, I can just click here and find more information. But this is the toolkit that I mentioned. And states will often come here and they'll look. You can search by all different, and I'm not going to get into this real deep here, but you can do a big search and find all different types of interventions in different sectors and hitting different behaviors. But here I just pulled up Pick a Better Snack, and here you can see it's identified as direct education and social marketing. And there's a little bit more background here about our program. So really, just I say this to say we're becoming quite popular, and I'll talk more about this tomorrow. But because this is approved, other states are picking it up. And so I will go into that a little bit more tomorrow. Let me get back to where I want to go. Okay. So even though Pick a Better Snack is considered a direct education and social marketing program, we have done a good job at integrating a PSC strategy, which has been pretty natural for us, and that's farm to school. So farm to school encompasses a lot of different things. It encompasses local foods in the cafeteria, it encompasses school gardens, it encompasses garden or ag-based nutrition education. But farm to school has been, it is considered a policy or systems environmental change strategy, and it's fit naturally into our program, mostly because our nutrition educators were incorporating gardening activities into the lessons, and school gardens were becoming more and more popular, and our educators were becoming more interested and involved with them. For those of you that are part of Food Corps, you know that Food Corps Farm to School aligns right with Food Corps. The strategies are nearly the same. For those of you that don't know much about Food Corps, it's kind of like AmeriCorps, a service organization, and people come out of school and give 2 years of service with Food Corps, and they're placed in schools to help with different wellness and farm to school strategies. So Iowa was lucky enough to be one of the states to be able to have Food Corps members, and we have 11 of them in Iowa and 10 of them work in our program. So all of this to say is that while Pick a Better Snack is direct education and social marketing based, we've easily incorporated some PSE activities around farm to school, and that's what you saw in the grant application this past spring that many of you applied for and some of you are participating in. Okay, back to Pick a Better Snack. These are our overarching goals for the program. So our focus is on elementary age children, and we aim to increase fruit and vegetable consumption of children, promote daily physical activity, specifically at least 60 minutes a day, and encourage parents to provide healthy foods and active lifestyles. So pretty straightforward and simple. And I've talked a lot about the evidence base for Pick a Better Snack, and now I'm going to go a little bit into more detail about that. So in 2011, 2012, and just hang on, I'm coming to a question period in a moment here. So if you're getting a lot of questions, we'll have a chance to address those here in a second. But in 2011, 2012, Pick a Better Snack received funding from USDA to undergo a very rigorous impact evaluation. At that time, our program was called BASICS. So that's another acronym. I think it stood for Building and Strengthening Iowa Community Support for Nutrition and Physical Activity. Anyway, since then, our program name has been changed to the Iowa Nutrition Network School Grant Program, which we commonly call Pick a Better Snack. So I often use those terms interchangeably, just so you're aware of that. But anyway, in this study, it was called Wave 2. That's what USDA named it. There were 2 intervention groups, Basics and Basics Plus, and they were compared to a control group. So a group of kids that did not receive any intervention. They didn't receive any Pick a Better Snack lessons. Each of these 3 groups had the same number of schools that participated, and you can see the communities that were involved. The study looked at the Pick a Better Snack program, how it was implemented, what impact it had on students' preference for fruits and vegetables, and their consumption of fruits and vegetables. So we also had a piece around low-fat and non-fat milk and dairy products. So there was a component of that to the study, but we've dropped that behavior goal, and now we're only focusing on fruit and vegetable consumption and physical activity. So the basics group that you see in the middle received nutrition education only. So that's like they only got the Pick a Better Snack lessons. The Basics Plus group on the end got the Pick a Better Snack lessons plus social marketing. So what did we learn from this? Well, we learned that both of these intervention groups, the basics and basic plus, did increase fruit and vegetable consumption, but we saw a larger increase with the basics plus group. So social marketing was really key to a stronger program. There were other measures that the study looked at that we saw improvement with basics plus, but overall we just saw better outcomes with basics plus. So that's why we stick with our social marketing piece as well. I do have 2 links down here. I won't click them now, but you can find a lot more information about the study and the evidence that came from them if you would like. So we do continue to have a big evaluation piece in our program, and you may recall from the RFP, and you'll see in your contract that there's this requirement to participate in any engagement activities that we have going on. And that's just because SNAP-Ed, we need to make sure that we are staying on track and that we continue to produce outcomes. We haven't done a big study like Wave 2 since, so now, it's been over 5 years now. It's really expensive to do something like that and really time intensive on our end, and unfortunately a little bit on yours too. So, and we haven't really needed to. If we kind of stick with the same program outline, we shouldn't have to go back and do a full assessment like that every year. But we do periodically have evaluations going on. For example, in 2014, we did a big evaluation where we worked with the University of Iowa, and their evaluators did a lot of phone calls to parents in our program and went through a lot of information. They found out, are kids talking to their parents about fruits and vegetables? Are these program materials like the bingo cards and newsletters being used? So there's a big study done then, and good results came out of that. Now, gosh, I guess it's been a couple years now as we're starting a new year here, but we did a student assessment in school year 26-2017, and this was a pre and post survey that was delivered to students before this lesson started, and then again in May after all the lessons were done. We only did it with 3rd graders, and we didn't do it in every classroom, usually just like one classroom in each school. But again, we were just looking at some of this information. We didn't get consumption data, but we did check on preference for fruits and vegetables, asking behaviors. By asking behaviors, I mean, are kids going home and talking to their families and parents and caregivers about the fruits and vegetables they're trying in class? Are they asking for them? Are they relaying some of this information about how to prepare these items? We also looked at self-efficacy, meaning did they have the confidence to, again, ask for these things, to choose a fruit or vegetable for a snack, just their general beliefs around fruits and vegetables, and just recognizing some of our program logos. So this document's a 2-page document, and I just kind of flayed it open here, but you can access it on our website. There's a link down here. You can see, click here for reports. So if you want more information, you can find it there or talk to me at any time. I kind of bring this up too because we're planning not this year, but next year to do another evaluation. Our initial thought would be that it would be an evaluation with parents. I don't know, there could be a student piece involved, but typically it does involve you all when we do something like this. As kind of a side note, our program evaluator took another position in our department this summer, and we're in the process of hiring somebody new. So some of this will be clearer when that person is in place. So like I said, there would be time for questions. I'm going to pause here, and we're doing pretty well, I guess. We're about halfway through and 30 minutes into the webinar. If anyone has questions. And I will unmute you all. Okay, you're all unmuted.
Give you my number then? So Susie?
Yeah.
I have a question. This is Sue
Sure.
Henderson. How, I know you talked a little bit about the budget and where the money, SNAP money comes from. How certain are you that that's going to continue for the duration of the grant?
Yeah, I mean, we're pretty hopeful. We're in this grant, we kind of run on 6-year project periods. So you all should be funded for 6 years, given we have the money from the Farm Bill. Um, we're hopeful that, there's two different versions, the Senate and the House. The Senate really had no changes. The House had changes, but it wouldn't mean that they were pretty significant to the program. But it wouldn't be that we wouldn't get funding. It was more in the way that it's delivered, and they wanted to kind of change kind of the the money flow process and run it through different organizations. But so at this point, we're pretty confident we'll be able to fund the program.
Okay,
But
thank you.
it will make us feel better when we see what the Farm Bill is.
Sure, thanks.
Sounds like I hear somebody from our department. We have a testing going on over the intercom. Okay, so, and I'll check the chat box to see we do have really no questions there. Okay, so I'll mute everybody and we'll move on. Okay, here we are in our agenda. We're down to logic models. Sounds fun, huh? So we talked about the evidence for Pick a Better Snack, and this just dives a little bit more into the scientific theory around it. So nutrition education interventions typically have these logic models and scientific theories that kind of explain and predict the behavior changes that we're expecting to create. For those that are interested, the particular theory that we use is the social cognitive theory, which says behavior is the result of personal, behavioral, and environmental factors. So it's not just that an individual needs ability and skills to make healthy choices, but they need an environment to support it. So you can look again at all the details here around how we're anticipating kids will change behavior and eat more fruits and vegetables or be more physically active. And a lot of these constructs are woven into our lessons. So we have things like we want kids to know that fruits and vegetables are healthy, know why they're important to eat. We want kids to think that their peers, their friends like to eat fruits and vegetables. We kind of want that positive peer pressure to happen. We want kids to think that their parents and families believe it's important for them to eat fruits and vegetables. We want kids engaged with like the growing process and just food prep and food exploratory to get them excited about fruits and vegetables. So all of these pieces are constructs that are built into our lessons. And something else that we rely on, I've talked about this asking behavior. We've called it pester power. So kids ask their parents for things. They pester them, right? They do this all the time. We just want them to ask for the good stuff. So rather than saying, hey, mom, dad, can I get, a bag of chips or candy? We want them to ask for good stuff. And we think that it can happen. And our research, the one I mentioned specifically where phone calls were made to parents, showed that kids are talking about this stuff and parents aren't bothered by it. You kind of think, oh gosh, I really don't want to make it difficult on parents and have kids asking for stuff that parents can't give. But even if parents can't buy it or choose not to, they aren't upset by this and they feel proud that their kids are asking for something good. So, and this, I won't go into this, is a little bit more detailed logic model and just kind of has all of the pieces of our program, the direct education, the PSCs, the indirect education, the social marketing, all of that is inputs, and then what are the behavior outcomes that we expect over time. And you can look at that in more detail if you'd like. So moving on to the Pick a Better Snack lessons. These have changed some over time. I think they've been a little bit more developed and a little bit more scripted over the past years. Recently, we've spent time updating them since that Wave 2 evaluation. The current lessons were written by one of the nutrition educators that is still with us at Des Moines Public Schools, and they've been even updated in the past couple of years. I collected feedback from nutrition educators as they were using them and tweaked them a bit, and I spent more time with some food corps members, and we really worked to have techniques in there that would engage all students a little bit better. And you'll probably see that more in the year 2 lessons that we'll use next year rather than the year 1 lessons that you're using right now. But I feel like we're always evolving them if we can and making them better. They still follow the same format that was used in Wave 2, and I feel that's important because that's kind of the tried and true format, and but there is room for flexibility. So we do have a tasting schedule, and this isn't always so apparent. You can see this in the lessons as you look at them individually, but we have 2 sets of lessons. There's a year 1 set and a year 2, and we just flip-flop. We rotate back and forth between the 2 sets. This year we're on the year 1 lessons. Each set of lessons has a tasting schedule, which you can see here in kind of how it was organized by different categories. Each month has kind of a featured tasting, and that's our main focus. But if for some reason you can't or don't want to focus on that one, you can choose the alternate food. So for example, jicama is one of those that some educators, especially those in smaller communities, can have a hard time procuring because they're just not very prevalent in stores or wherever. And so you may feel like, okay, we need to focus on something else like sweet potatoes or carrots you see in the alternate. But for the most part, we like you to focus on the featured item because the materials are really developed around that best. And not to say they wouldn't fit or work for the alternate ones, it just works a little bit better. We do ask that you don't interchange these, like you don't say, you know what, next year or next month in November, I want to do bell peppers, and then in February at bell pepper time, I'll do cranberries or something like that. We want you to stick with either the featured or the alternate produce item in that month. Like I said, there is room for flexibility. So just looking at what's required, and these should map pretty well onto the constructs that I've just talked through as we looked at our different logic models. So each lesson, and I will pull up a lesson here in a minute, but each lesson has a physical activity. So that's something you must do. And I think it's even written into your contract. The physical activity need not be very long. They're just like classroom activity breaks. You know, maybe a couple minutes. So it really isn't long. And there's one outlined in the lesson. But if you know of a different one, and we can give you resources for those, but you'll see that there are lots of these classroom activity break options out there. You may find one that you like better or that you're just good at or kids really like. It's fine for you to do a different one than what's listed in the list. It's just that you must do one. You are required to taste a fruit or vegetable every month. And we just went through what to taste. That can't be skipped. You must do that. You must have kids vote to how they like it. So we use this thumbs up, thumbs sideways, thumbs down. That's something that has to be in there every month. That's that construct of wanting the peer influence for eating fruits and vegetables. Engaging children, that's kind of vague, I realize, but it's just this piece. You must have kids interacting and you must engage them. Some of that's just naturally going to happen because you're tasting a fruit or vegetable, but anything you can do to engage children, have them respond and participate, is going to be very beneficial. And we'll spend time tomorrow talking about different techniques for that. This asking discussion, or this pester power that we rely on, is critical. So we want kids to go home and talk to their parents about what they tasted in class, what they learned about it, where can you get it, how can we eat it for a snack, how can it be prepared, and for kids to, if they like it, let their families know and say they will eat it, and for kids to follow through and hopefully do that. The program materials, the bingo cards and newsletters must be used. This is our indirect education, if you remember. They're required in at least one grade level. So some people may choose to only do it in 3rd grade, but you can do it in all the grade levels. And, or you can do it, like I said, in all. The bingo cards we supply, as you know. The newsletters you print off from our website and make copies for your families. We did allow, starting with this new project period, the newsletters can be distributed electronically instead of hard copy if you choose. So that's fine if you just want to do it that way. With a lot of the schools going to virtual backpack and that kind of thing, it's okay to just do electronic distribution. The incentives for return bingo cards must be used. We have that kind of built in as a motivator for completing that activity, and we've provided those, and hopefully those can be used, and we'll talk about creative ways to use those. They're meant for kids returning a completed bingo card get an incentive. We've purchased those because USDA SNAP-Ed requires that the incentives be tied to our program, so they have to have our messaging on there. You'll see the Pick a Better Snack or Play Your Way, and if room, they have to have a credit statement to USDA. So on some of the products you'll see that, where other products there just isn't room. And there is a dollar limit on those. They've upped it here recently. Everything must be under $5. The children's stickers we've provided, and hopefully you all have those. Hopefully they work well too. We've tried to communicate some of the feedback I've had from educators over the year on making sure they peel nicely and all of that kind of stuff. But the stickers are meant to communicate really that message home of what the kids tried at school. So if you have kids in school and you've got school picture day the next day, often the kids will come home with a sticker saying, pictures are tomorrow. So we're kind of using that idea that kids can let their parents know in this way. So where does the flexibility come in? Like I mentioned, the type of physical activity is flexible. Tasting, you have to taste that fruit or vegetable, and you should taste it plain for starters. And then you can taste it with other activities. So it can be a raw, cooked, canned, frozen, or whatever, but we don't want everything to be with a dip. So we don't want kids to think, oh, I can only eat a vegetable with a dip. So we want them to get the real taste of it. And then if you're like, okay, I also want to show you how you can eat it with this dip, or this is how you can make hummus and other things that way. Each lesson typically has a book or more suggested that you could use. You don't have to read them though. Some people really like children's books, and it's an easy way to connect and engage kids. Others, it's just not their thing. So it's not required that you read the book, or if you know of a different book that fits really nicely with the topic, you're free to use that. The lessons have an activity section, and there's often several options. There's usually more there than you'll have time to execute in class. So you can choose one of those things, or even if you know something else and you want to go a little bit different thing, like in October, and we'll look at that here in a minute. I think I'll hold off and talk about that in a second. Some of the lessons will have worksheets or videos, coloring pages, all of those kind of extras. Some educators like to use those for transition times while they're getting a produce item, or like to have them sent home, but you're not required to use those. So that's up to you. There are sections called fun facts and what you need to know. These are good talking points as you're working through the lesson. but they're not required. You don't feel like you've got to make sure the kids know all this information. That's not the intent of it. We're really relying on this being a fun, positive, high energy experience for kids, and that's going to be more impactful than them knowing that carrots are a good source of vitamin A or oranges are a good source of vitamin C. So we're really just relying on, you know, the peer pressure and the tasting and the engagement to make a big difference on the kids. So here I was going to look at one of the lessons. And again, this is our website. And you can see our year 1 lessons are here first, and then year 2, which we'll use next year. Each month has 2 sets of lessons, one for kindergarten through 1st and one for 2nd through 3rd. They don't differ a whole lot in most months. It should be a little bit more sophisticated and advanced in 2nd and 3rd, but I'm going to pull up the K1 and just kind of talk through these, and you'll see the different components here that I was just mentioning. Here's our featured item, but let's say you don't want to do cantaloupe, you can choose honeydew or watermelon. Here are a few book ideas. You don't have to read them. Jumping to this 21st century skill, we don't tie our lessons to Iowa Core, but we do tie it to this 21st century skill, and those are important standards, as I understand it, to educators. And it was just easier to make the connection there with our lessons. The objectives are really for you all as educators, what we're trying to accomplish here. And you'll see the consistency across each month. The recap should be done. It's just kind of bringing kids back to the place, getting them grounded in the Pick a Better Snack program here, reminding them of what was discussed last month, a chance to engage all the kids. And it's amazing what kids remember. And you know, they'll recall several months ago or even a year ago what they tasted in Pick a Better Snack. So it's really kind of funny. And here are the kind of talking tips from what you need to know and fun facts that you can choose some facts out of there to share. You don't have to. The physical activity, we use these Get Moving activity breaks from a booklet that we are printing and will provide to you. So there's a nice selection you can choose from in those booklets, and then a few are pulled out and placed in the lessons. Discussion topics, like I said, the discussion and activities. Now there's not a lot listed here for the activities in this first month, but the discussion from the start tends to be around, you know, setting the stage for how the program will go and for how items will be tasted. So there's lots of room for flexibility in what you kind of choose to focus on. Health connection, there's usually always a tie to health, usually around vitamin A, vitamin C, fiber, and tasting. Ideas for how to taste the item, but you may come up with other ideas, and you'll hear on our monthly calls some different ideas too for what you can do with the tasting. This closing discussion is where the asking piece comes in, where you can talk to the kids about bringing this message home to their families. And then the take-home materials, just a reminder to use those. And these references or resources are typically sources that we've used to put the lesson together, or places you might want to go and look for more information. Okay, we're coming near the end. I'll just click back to our website again. You're probably all familiar with it now if you've explored a bit, but this is our home page, our landing page, and you can see some of our marketing videos here, links. We do a lot of marketing, and I can talk more about that in our calls to parents. In fact, we're going to kick off a campaign here this month, and so we're doing some like web ads and Facebook ads, and so it will bring parents to this page. So that's why we mention the family newsletter, bingo cards. There's a lot of websites here that we recommend for good nutrition and physical activity information, and then just highlighting some of our programs that have been in the news. Anyway, want to make sure you know bingo cards. You can find them all here, both in English and Spanish. I know you have them for use. Here are the lessons that we've just looked at. Fact sheets. There should be one for every month, and these can be used in a variety of different ways. Sometimes they can be used actually with the fresh fruit and vegetable program. Teachers can provide information as they're delivering snacks. Other people like to make bulletin boards with these items. There's a lot of different ways you can use them. Coloring pages are just supplemental too. They can be a nice transition time during your lessons to keep kids busy and out of trouble. You can just send them home. Also, some people like to print them on the back of the family newsletter. That's another option. So you can use them in any way you'd like. You could just wait and use them during summer nutrition education or after school nutrition ed. And program sites, we do have all of our school buildings that are participating should be on this map, and I'll have you look at this over the next month or so and check it out and make sure that I have the information accurate. We might have some name changes. You can see, you can kind of scroll in and move it around and find the schools. And then the contact information is not the school itself, but it is the nutrition educator and their phone number. So Play Your Way looks very similar to the Pick a Better Snack landing page. We do have our marketing Play Your Way video there. And then we do have, oh, I do want to jump back up here. So this school grant program, I think this probably often gets overlooked, just the way these tabs are laid out. But this is just background information to our program. And this is the link that takes you to that map that we were just looking at. Here's a different look at our participating communities. You can see the counties involved and the school districts. And here, if you click Educator Resources, you can go to these Wave 2 studies that I mentioned, or that third grade student evaluation. I will probably update this link with the webinar that I have going on right now. Civil rights, we'll talk about that tomorrow. These are some presentations from last year's training, which I'll have to update. And then other resource links related to farm to school, school wellness environments, physical activity for you to check out. We do have other SNAP-Ed initiatives that we deliver out of our office, and you can see them here. The older adults program is one of our big ones, and that's a really awesome program. It really focuses on kind of the latest kind of nutrition news, and older adults are in discussion groups typically held at congregate meal sites where they're there for a meal anyway, and they're talking about different nutrition topics and tasting something and a new recipe and figuring out how they can make these changes. But really good program, and you can find more out about that there. And then Shop Healthy Iowa was an initiative we had in Hispanic grocery stores. So you can check that out. And SNAP, which I showed you earlier, and then this nutrition assistance link has several federal nutrition programs. And this is the We Can Help brochure that we put together, and we have ordered for you, and you'll be getting that in the next month or so. But you can see that it's just a resource where people can find out how to connect with some of these programs. So there we have it. That's all I had planned for this morning. I am going to again open it up for questions. And again, we do have Marilyn Jones on. If you have any contract or fiscal questions at all, she'd be glad to take those. So let's see if I can unmute everyone. There we go. I'll check the chat box. Okay, it looks like we don't have any more questions, but don't worry, we'll be seeing each other tomorrow. So bring your questions if they come up. And we're just right at like 55 minutes. So we're done a little bit early. I'll go ahead and end the webinar now, and we'll see you all tomorrow. Thanks, everyone.